So let's have a look. I'll have to put you on the other screen. So thanks a lot, and I will present in the next 25 minutes a little bit about different models of follow-up care, and I will also introduce the recommendations of how follow-up care should be organized. So I will start with the evidence-based recommendations that we have recently published, and I will then present 4 models of survivorship care that generally can be distinguished. So they're all kinds of mixed up of these 4 typical models, but I will just briefly show you these 4 models. And finally, I will present some results from our own research on what survivors need and about their preferences of how follow-up care should be organized. So let's first have a look at these recently published recommendations on how follow-up care should be organized. So this is the paper we have recently published with the PanCare SIOP Guidelines Working Group, and it is based on a systematic review of all the evidence that we found on the organization of long-term follow-up care. So the aim was to develop pan-European guidelines with recommendations on how long-term follow-up for survivors of childhood, adolescent, and young adult cancer should be organized. And this guideline should help healthcare providers, but also patients, survivors, and their parents or caregivers with recommendations on how follow-up care should be provided and what they should be able to expect. So I don't want to go into detail regarding the methods of our guidelines, but generally we first identified 2,823 abstracts. We reviewed and screened those abstracts. We reviewed 273 full text articles, and finally we were able to include 84 studies on which then our recommendations are based. So this is just like our final recommendations, and I will now go briefly through step by step through these recommendations. So the recommendations cover 1 general overall recommendation and then also 4 key issues on specific aspects. So the first would be the organization of long-term follow-up care, then the personnel which should be involved for long-term follow-up care, the different components that should be covered, and finally, when long-term follow-up care should start. So our first general overall recommendation is that long-term follow-up care should be available and accessible for all childhood, adolescent, and young adult cancer survivors throughout their lifespan. So everybody who suffered from cancer at a young age, anywhere in Europe, should have access to long-term follow-up care lifelong. But then we get a bit more specific. So long-term follow-up care should be provided in or under the guidance of a cancer survivorship expert service or cancer center. And it should also provide multidisciplinary care. And we'll come to this a bit later. So you should not have like a general practitioner doing follow-up care on his or her own, but they should always collaborate with experts in childhood cancer and late effects. So then we recommend, do you still see my screen? Just lost my
now
slide.
It's black.
Yeah, don't know where my slides have gone. I just stopped So here we are again.
Yes.
Good. Yeah. So now we missed one. Yeah. We also recommend that healthcare providers should make the decision on the optimal model of follow-up care together with the survivor, and they should base this decision on the previous cancer treatment, the current health conditions, but also the preferences of the survivor, and also the characteristics of the healthcare system. So we've also found it to be important that providers of long-term follow-up care have the commitment of the national or the local and the local healthcare provider or the healthcare system, and also the insurers. And we will also come back to this later on. And then it's also important, and we thought this is really important to have it in the recommendation, that the providers have sufficient time for consultations available. So this really needs to go together with the healthcare system. Then regarding the personnel involved in long-term follow-up care, we recommend that each survivor can make their own informed choice of the healthcare provider. But as we have said before, this choice should always be based on a discussion, informed discussion together with the provider. And the survivor should then really make an informed choice, not just I like this more than that. So survivors need to know the cancer, the treatment they had, the associated risks, and how follow-up will work in the choice they make. And it's important that the survivor can organize his follow-up care or attending follow-up care later on. So then the long-term follow-up care team should ideally include a key worker or a coordinator who organizes all the follow-up visit and who keeps the overview about what is needed, where it's done, when it's done, and by whom it's done. And this coordinator should really help to empower the survivor to make their own decision. Then we need a lead doctor specialized in late effects, who will take over like the medical lead and keep the overview on the medical side. And this could also in places be done by a nurse practitioners. That's not the case in every country, but in many countries it can be done. Then there should be a multidisciplinary expert team of specialists available during the follow-up visit. And there should always be the possibility of consulting additional specialists depending on the risk or the late effects, but that does not need to be available at every visit. So survivors can be referred to these specialists later on. So then we have the components of long-term follow-up, and they should include, first of all, the surveillance and preventive strategies. And these should be based on the evidence-based guidelines that you have had a look at this morning. Then the coordination of care, and this is particularly important if we have a shared care model. Then it should also include the education of the professionals, such that they know what should be done and that they keep updated on changes of the evidence, of guideline, of recommendations. And it should also include education of survivors, families, carers, and this is especially important with the increasing age of survivors. So they, with increasing age, survivors need to take over the responsibility for their own health and for their own health care, for participating in follow-up care. And to do this, they need to be informed and educated, depending on their age. They need to be better educated about the disease they had, the cancer, the treatment, and also the future risks. And finally, we also thought it to be an important component that long-term follow-up should also allow for scientific research in order to get new evidence and also to provide the best care in the long term. To support long-term follow-up care and also to empower survivors to take their own responsibility for their care, we also recommend the Individualized Survivorship Care Plan that you have already looked at this morning or early afternoon, I think. And yeah, you will have seen that it's important for the survivor to understand what has happened, but also for new doctors, or when survivors move for new healthcare providers, to understand what has happened, what diagnosis they had, what treatment they had, what risk the survivor has. As I said before, patient and parent education is important to support the effective self-management. And then it's also important to include and systematically plan for changes of care. And you'll have a look at this after this presentation. So we recommend to really plan the transition of care first, from active treatment to long-term follow-up, then from survivorship care to primary care, if this is possible, especially for low-risk survivors, and also, of course, for change of care, transition of care from pediatric to adult healthcare services. And then we have our final recommendation: when should long-term follow-up care start? And we recommend that it should not start later than 5 years after treatment or after diagnosis. And just to repeat again, it was very important for the whole group who wrote up these recommendations, that these recommendations need to be adapted to the healthcare system. So we don't want to make a recommendation that you need a nurse practitioner if the system doesn't allow for it. So then in the next part, I would briefly like to present 4 models of survivorship care and their advantages and disadvantages. So we have these 4 models that we can distinguish in general. The first model would be the pediatric oncology model, and this is probably the most frequently used model currently. And in this model, the long-term follow-up care is provided in pediatric oncology by a pediatric oncologist. Then in the second model of long-term follow-up care, this is the medical oncology model. Here, the care is also provided by an oncologist, but in the adult setting, so a specialist for adult oncology, the medical oncologist. Then we have the interdisciplinary team model. And in this model, a team of different specialists provides the long-term follow-up care together, and depending on the needs and the risk of late effects, the respective specialist can provide the care. And finally, we have the general practitioner model that I have already mentioned. In this model, the survivor is transferred from pediatric oncology to his general practitioner, and very often in this model, a close collaboration between general practitioner and specialist is recommended. So this would ideally really be a shared care model. And this model is particularly helpful for survivors with a low risk for late effects. So now let's have a look at the advantages and disadvantages of these 4 models. So in the pediatric oncology model, we certainly have the pediatric oncologist as the specialist providing the follow-up care. Pediatric oncologist has expert knowledge on childhood cancer. They know treatment, they know the risk of late effects. But the disadvantages are the success story, essentially, the increasing number of survivors, and the workload of pediatric oncologists gets bigger and bigger, and follow-up care often needs to be done next to acute patient care. And another problem is that pediatric oncologists are pediatricians, and they lack the knowledge of the needs and health problems of adults. And survivors, most of the time of being a survivor is being an adult. And finally, the care in the model is provided in the pediatric hospital, and it might not always be fun in the long term for adult survivors to go back to the pediatric hospital. So in the second model, we can also profit from the expert knowledge of oncologists, and in this model also from their expertise in adult problems. But with every change, there is the problem that survivors might be lost during the transfer or transition to a new model. And in addition, although the medical oncologist has expert knowledge on cancer and treatment, they don't have the expert knowledge on childhood cancer. And in many ways, childhood cancer is very different. So we have the interdisciplinary model. And again, we have expert knowledge, access to specialties that all the survivors might need. And the different needs can be covered in one clinic by experts. But again, we have the problem of transition. So when we transition the care from one model to the next, survivors might be lost. They might be afraid of the change. They might, at a certain age, not be interested in follow-up care. And because the new experts, the new care team don't know them, they might not miss them, and they might just be like forgotten and lost. And in addition, the accessibility and availability of all these experts, this might be rather expensive, but it might only be expensive in the short term. If we can prevent health problems in the long term, it might actually be a somewhat cheaper model, but not sure if the health system always understands this. Finally, we have the general practitioner model. And the general practitioner has the advantage that it's very easily accessible for the survivor. Often the general practitioner knows the patient very well, and this model is compared to the other models relatively cheap. But again, we might lose survivors during the transition. And the bigger problem is, of course, that the general practitioner, they don't have the knowledge on childhood cancer, and they might not be able to provide the most adequate care. So the shared care model, to work together with an expert center, is therefore very important in this model. So it's very important to choose the right model for each survivor. And the survivor with a high risk for late effects, they might just profit most if they have access to the interdisciplinary team. A survivor who has not had chemotherapy or radiotherapy, they might have enough and good enough care with their general practitioner, who most often is also geographically very close to the survivor and the general practitioner. But it is always important that, especially with the general practitioner model, that they can go back if they need it. They can go back to specialist care, to an interdisciplinary team, to a specialized follow-up care clinic if it's needed later on in their survivorship. So for the end of these presentations, I would now just like to present some results of our research on the needs and preferences of survivors. So most of the evidence in our recommendation came from experts, from oncologists, nurses, psychologists, researchers, and so on. And only a relatively small number of papers covered the interests of survivors themselves. So here I would like to present you just some of this information. And the results of these studies are that I present now come from studies in Switzerland, but we have also done some of the studies in England, and the results are generally similar. So it seems that survivors' preferences, they are similar, at least in several countries. So first we wanted to know where would you like to go for the follow-up care? And survivors like to have their follow-up care in the children's hospital, in the adult hospital, or at the general practitioner. Although a centralized, specialized late effects clinic might make sense in a small country like Switzerland, this was not really favored by the survivors in Switzerland. So they really want to go somewhere they know and geographically close to where they live. Then second, we wanted to know what is important for survivors during follow-up care. And important are the following aspects: so that there is competent staff, that they are being taken seriously, the quality of the relationship is important, and also that it's funded by insurance. And we'll also come back to this. And the continuity of care, so that they can see the same doctor every time and not different people every time they come there. And then we have also asked survivors what they think should be included in follow-up care, and found that the clinical aspects are most important. So checking for relapse, screening for late effects, and information about potential late effects. That's what is important during follow-up care. But also getting to know about the risk for their own children is something that survivors want to know about in follow-up care. And as a psychologist, I was not entirely happy, of course, to see that psychological counseling is only of average importance to survivors, at least when we look at it in long-term follow-up care in the medical setting. But our own and various other studies have shown that survivors are at high risk for psychological problems in the long term. And so we have done a mixed method study and found that survivors indeed have a strong need on the one hand for more information, but also for psychological support. And regarding psychological support, one survivor said that or highlighted that they not only need support during treatment when they often get psychological support, but also years later, because as a teenager I was dealing with other topics than now as an adult. And other survivors said there's just nothing, zero psychological support. So that's something that survivors miss, but maybe not in specific follow-up care in the clinic. somewhat, for me, unexpectedly, we also found that quite a few survivors reported problems with insurances. And in Switzerland, everybody needs to have a compulsory health insurance, and this should actually cover all the necessary treatment that is needed. However, survivors have sometimes problems in getting additional insurance, selective medical treatments, and also for psychological counseling. And one survivor stated this very clear. What I think has stuck me most of all are not the physical aspects, but the whole thing with insurances. So to end, not only regarding psychological support or other kinds of support, survivors agreed that there is a need for coordinated care. And I would just like to read the quote of these survivors. It would really have helped to have someone who could figure it out, for whom perhaps it would also not take so much time and effort. Such a person could have really taken care of the situation. But I do not think such a person exists. I think that is really something to strive for, really someone expert on childhood cancer specific concerns. So someone can really support you. So here we see that the coordination of care is really an important thing in the long-term follow-up as well. So with this, I come to an end, and I hope I could show that well-organized long-term follow-up is important and will help to improve health outcomes and the quality of survivorship for the current and also our future survivors. Thank you.